We are back and the doctor is in the house. Today we're visiting with Dr. Alexander to talk about scoliosis here at South Texas Brain and Spine Center. Now, my father actually was born with scoliosis, so I'm excited to learn a little more on this topic. Is it still common? Is it something that we don't see as much of? Because I feel like I don't hear the term as often.
Well, it is pretty common. Typically they diagnose them very young.
So is this a genetic, something that is carried on in your family, or is it something that you can randomly be born with?
It's both. You can be both environmental, so if you push yourself, do manual labor, lift things incorrectly with your back and not your knees, you cause more stress on the spine and puts you at increased risk for having a degenerative scoliosis.
Okay, so it can be developed later in life too. It's not always something that you're just born with.
Correct.
Interesting. Okay, so how is scoliosis treated? I know there's a lot of technology these days, but we always talk about the steel rod in my dad's back from when he was little. So what does that look like? So
typically it all depends. So in younger patients, we can actually try an brace to see if we can mold the spine or stop the scoliosis progression. If the progression gets to a point where it causes deformity or causes severe pain, those are the patients we do surgery. So it all depends on your degree of curvature, which is your scoliosis, and through symptoms.
Okay, and I think about my kids, and of course we don't want our kids to go through any pain. That's our life's job, is to keep them away from danger. Is that something that's painful, treating scoliosis in kids, when you try to do it non-surgically?
It's wearing a cumbersome brace. So some kids will wear the brace, some kids don't. Sometimes it doesn't work.
That's like wearing your retainer, right? Like you got to keep it consistent.
Correct.
Very interesting.
And sometimes if you do surgery earlier when they're younger, they can tolerate it better, they can get a better correction. So it depends on the degree of scoliosis.
Absolutely, and kids are very resilient. We know that from a few that have bumped their head a few times, right? Myself included. So talk to me about other degenerative diseases that you're able to treat here at your location.
Cool. So we have, this is a model of the spine. So the most common in adults that causes back pain is called spondylolisthesis, which means spine slippage, where the spine is disaligned. Typically, we're pretty conservative. You would go for injections with pain management. Typically, we also refer you to physical therapy, trying different medications. If we fail all that, then we typically go to surgery.
Okay.
If you have like weakness or numbness, or sciatica like pain, those are the patients that we would treat surgically if they're not responding to conservative treatment.
Very, very interesting. And what are these other two gadgets that we're looking at here? Some other strategies?
So you always hear a bad rapport on spinal surgery, and everyone gives their 2 cents, and they don't live how the patients are living. So you see patients that have pain for they're in a wheelchair. I had a patient that did surgery on yesterday, and she actually had a large skull-like deformity. She came in almost paraplegic, and you don't want to get to that point because then it takes much, much longer to recover, and you might not recover. So it's that fine balance. The nerve, if it's damaged, it can be permanently damaged. It won't recover. So you got to get to the nerve and decompress it, stabilize it as soon as possible on certain patients. So this is screws from the back we put in. You can actually go from the side and do a small incision and put a minimally invasive cage and a little plate and screws. So it all depends on the patient on how we can treat it.
Very interesting. Okay, so the common misconception that you have to be a specialist for this, but they can actually treat these things right here at South Texas Brain and Spine Center. So stop by, give them a call, and as usual, mention that Coastal Living sent you. Thank you so much.
Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.